In this video, we'll go over 11 warning signs of pancreatic cancer. Stick around because we'll cover 3 extremely unusual signs that you probably have never heard of. Pancreatic cancer, often referred to as a silent disease, can progress unnoticed until it reaches advanced stages. However, there are symptoms that, if recognized early, can prompt timely medical attention and potentially improve outcomes. Number 1 is itching of the skin. Itching of the skin, medically known as pruritus, can be an early and often overlooked symptom of pancreatic cancer, especially when associated with jaundice. Jaundice occurs when there is a blockage in the bile ducts, often caused by a tumor in the pancreas, which prevents bile from draining properly into the intestines. This leads to a buildup of bilirubin, a yellow pigment that results from the breakdown of red blood cells. Normally, bilirubin is processed by the liver and excreted through bile, but when it accumulates in the bloodstream, it can deposit in tissues, including the skin. The itching caused by bilirubin buildup can be intense and debilitating, often described as a deep, relentless itch that doesn't respond well to over-the-counter antihistamines or topical treatments. It may initially appear before the visible signs of jaundice, such as yellowing of the skin and eyes, making it an important early symptom to recognize. This itching is typically generalized, but may be more pronounced in certain areas, such as the palms of the hands and soles of the feet. Number 2 is unexplained bloating. Unexplained bloating, or an increased sensation of fullness in the abdomen, is another symptom that may indicate pancreatic cancer and is often overlooked because it can mimic less serious conditions such as indigestion or gas. This bloating, however, may be a result of more complex underlying issues related to the presence of a pancreatic tumor. Pancreatic tumors can interfere with normal digestion and the movement of food and fluids through the gastrointestinal tract. In some cases, the tumor's growth may physically compress surrounding organs, including the stomach, intestines, or bile ducts, leading to a sensation of fullness even after eating small amounts. This can cause discomfort or the inability to eat a complete meal, which contributes to weight loss over time. A more serious cause of bloating in the context of pancreatic cancer is the development of ascites, which is the abnormal accumulation of fluid in the abdominal cavity. This fluid buildup can result from cancer spreading to the peritoneum, the lining of the abdominal cavity, which irritates and stimulates fluid production. Alternatively, the tumor may block lymphatic drainage or blood flow, leading to fluid leakage into the abdominal space. Ascites often presents as a noticeable swelling or distension of the abdomen and may also cause associated symptoms such as nausea, difficulty breathing, or a feeling of heaviness. The bloating caused by pancreatic cancer is typically persistent and does not resolve with common remedies such as antacids or changes in diet. As fluid accumulates, the pressure in the abdomen can become painful and may even limit mobility or interfere with daily activities. Number 3 is lower back pain. Lower back pain is another symptom that may signal pancreatic cancer, particularly when it presents as persistent, deep, and atypical compared to common muscular or mechanical back pain. Unlike back pain caused by strain, poor posture, or injury, the pain associated with pancreatic cancer is often dull, aching, and unresponsive to conventional treatments like stretching, massage, or over-the-counter pain relievers. This type of pain occurs when a tumor in the pancreas grows large enough to press against nearby nerves or organs. The pancreas is located deep within the abdomen, near the spine, and tumors in this area can irritate or compress nerves, particularly those in the celiac plexus, a group of nerves that supply the upper abdominal region. This compression leads to pain that often radiates to the lower back. In some cases, the pain may worsen after eating or lying down, as these activities can increase pressure on the pancreas or nearby structures. The discomfort may also feel more prominent at night or during periods of rest, contrasting with the typical behavior of muscular back pain, which often improves with rest. Lower back pain in pancreatic cancer can also occur if the cancer spreads to the spine or other bones, further irritating nerves and causing pain. This is more common in advanced stages of the disease. The pain may begin as localized discomfort in the back, but can radiate to other areas, such as the abdomen or sides, depending on the tumor's size and location. If you're finding this video helpful, please like and subscribe. Number 4 is depression or mood changes. Depression or mood changes, while less obvious, can be an early and significant symptom of pancreatic cancer. Many patients report experiencing a sudden onset of depression, anxiety, or even feelings of hopelessness, often without a clear emotional trigger or prior history of mental health issues. These mood changes may appear months before any physical symptoms of pancreatic cancer manifest, making them a potential early warning sign. The connection between pancreatic cancer and mood disturbances is complex and not yet fully understood, but researchers believe it may stem from a combination of biological and psychological factors. One theory is that the cancer's presence in the body alters the production of certain chemicals, such as cytokines, which are involved in inflammation and immune responses. Elevated levels of cytokines can affect brain function, leading to changes in mood, behavior, and overall mental health. Hormonal imbalances caused by pancreatic cancer may also play a role. The pancreas is involved in producing hormones such as insulin and glucagon, which regulate blood sugar levels. A disruption in these hormones can lead to physiological changes that influence the brain's chemistry, potentially triggering depressive symptoms. Additionally, the cancer itself may release substances that affect neurotransmitter activity, further contributing to mood disturbances. For individuals experiencing a sudden and unexplained shift in mood, especially when accompanied by other symptoms, seeking medical attention is vital. Depression in this context should not be dismissed as unrelated. Instead, it can serve as an important clue in uncovering serious underlying health conditions, including pancreatic cancer. Number 5 is unusual changes in taste preferences. Unusual changes in taste preferences or the development of a metallic taste in the mouth are subtle but potentially significant symptoms that may be linked to pancreatic cancer. These alterations can interfere with the normal enjoyment of food, leading to reduced appetite and, over time, contributing to unintentional weight loss and malnutrition. The causes of these taste changes are not entirely understood, but they are thought to result from the complex interactions between pancreatic cancer, the body's metabolism, and the nervous system. One possibility is that the cancer alters the production or balance of chemicals in the body, such as cytokines and hormones, which can influence the brain's perception of taste. Additionally, tumors in the pancreas can affect the digestive process, leading to a buildup of certain byproducts in the bloodstream that may change how food tastes. The metallic taste specifically may be caused by metabolic disturbances resulting from pancreatic cancer. Elevated levels of certain substances in the blood, such as bile acids or ketones, could interact with taste receptors, creating a lingering metallic sensation. This symptom is sometimes exacerbated by cancer treatments, such as chemotherapy, which can further affect taste perception. Changes in taste preferences might manifest in several ways. Some individuals may develop an aversion to previously enjoyed foods, especially those with strong flavors, such as coffee, meat, or spicy dishes. Others might notice that food tastes bland, bitter, or off, making it difficult to derive pleasure from eating. This can lead to decreased interest in meals, reduced caloric intake, and eventual weight loss, which are common complications in pancreatic cancer. Number 6 is unexplained fevers. Unexplained fevers and frequent infections can be significant, yet often overlooked symptoms of pancreatic cancer. These symptoms arise because the cancer disrupts the normal functioning of the immune system, either directly through its biological effects or indirectly by weakening the body's ability to fight infections. Unexplained fevers are typically a result of the body's inflammatory response to the tumor. As pancreatic cancer grows, it can trigger the release of pro-inflammatory substances like cytokines, which are proteins involved in immune signaling. This systemic inflammation can lead to fever, even in the absence of an obvious infection. Fevers might be intermittent, low-grade, or persistent, and may not respond to typical treatments, such as rest or antipyretic medications. Frequent infections, on the other hand, often occur because cancer can weaken the immune system in multiple ways. For one, pancreatic cancer can alter the production of immune cells, reducing the body's ability to detect and eliminate pathogens. Additionally, advanced stages of the disease may cause malnutrition, further impairing immune function. For example, deficiencies in key nutrients like vitamins A, C, and zinc, common in people with significant weight loss, can reduce the immune system's effectiveness. Number 7 is swelling in the legs. Swelling in the legs, particularly if it occurs in only one leg, can be a concerning symptom and may indicate the presence of a blood clot, known as deep vein thrombosis. This condition is more common in individuals with pancreatic cancer due to the cancer's effects on the body's blood clotting mechanisms and vascular health. Pancreatic cancer is one of the cancers most strongly associated with an increased risk of blood clots. This is partly due to the tumor's ability to produce and release substances that promote blood clotting. Additionally, cancer triggers a systemic inflammatory response, which can make blood more prone to clotting. The tumor itself may compress nearby blood vessels, slowing blood flow and further increasing the likelihood of clot formation. Deep vein thrombosis occurs when a blood clot forms in the deep veins, typically in the legs. The affected leg may become swollen, tender, warm to the touch, and sometimes reddish or discolored. The swelling is often noticeable in the calf or thigh, and may be accompanied by a feeling of heaviness or tightness in the leg. In some cases, the pain associated with deep vein thrombosis can mimic muscle soreness or a pulled muscle, which can delay diagnosis if not recognized as a potential warning sign. Number 8 is difficulty swallowing. Difficulty swallowing, medically termed dysphagia, can be a troubling symptom of pancreatic cancer, particularly in its later stages. While pancreatic cancer primarily originates in the pancreas, its proximity to other critical organs and structures in the abdomen means that tumor growth or metastasis can cause complications beyond the pancreas itself. Dysphagia may develop when the cancer spreads to or compresses the esophagus, the muscular tube that carries food and liquid from the mouth to the stomach. This symptom arises for a few key reasons. If a pancreatic tumor grows large enough, it can exert pressure on nearby structures, including the esophagus. This external compression can narrow the esophageal passage, making it more difficult for food or liquid to pass through smoothly. In advanced stages, the cancer may metastasize to lymph nodes or tissues near the esophagus, further contributing to blockage or reduced flexibility of the esophageal walls. Patients with dysphagia may describe a range of sensations, such as a feeling that food is stuck in their throat or chest, pain while swallowing, or a choking sensation. Liquids may become easier to swallow than solids, but as the condition progresses, even liquids can become difficult to manage. This can lead to unintentional weight loss and dehydration, as eating and drinking become uncomfortable or even painful. Number 9 is abdominal pain. Persistent abdominal pain is another warning sign, often radiating to the back. This discomfort might intensify after eating or lying down and is caused by the tumor pressing against nearby organs or nerves. Jaundice, characterized by yellowing of the skin and eyes, is a red flag that should never be ignored. It occurs when a tumor blocks the bile ducts, leading to a buildup of bilirubin in the body. Number 10 is nausea and vomiting. Digestive issues such as nausea, vomiting, can also indicate pancreatic cancer. These symptoms arise from the tumor's interference with normal digestive processes. Fatigue, beyond the usual tiredness, can be a sign of the body working harder to combat the disease. Pancreatic cancer may also present with new-onset diabetes, particularly in those without a prior history of the condition, as the pancreas plays a vital role in regulating blood sugar. Number 11 is changes in stool. Changes in stool, such as greasy, pale, or foul-smelling bowel movements, may suggest an issue with the pancreas. These changes occur when the organ fails to produce enough enzymes to properly digest fats. If you or a loved one experience any of these symptoms, it is crucial to consult a healthcare professional promptly. Early detection is key to improving the chances of successful treatment for pancreatic cancer. If you found this video helpful, please like and subscribe. Thank you for watching.